Hey everybody, Brian Boyle here and welcome to episode 162 of The Mesh Tongue. Hopefully you are having a fantastic day, having a good week so far, so hopefully you are as well. We've got the Company Cup 5K and the Wasatch Mile coming up September 14th, so if you're in the Salt Lake area, you don't want to miss this. This is a Thursday night race. It's an after-work event. This is the race that I put on personally, and the whole point of this is to have an after-work event in downtown Salt Lake. Lots and lots of races in Utah. None of them are after work. Boggles my mind. I know those of you that are watching this that are elsewhere, you're like, dude, we've got tons of races after work. Nothing in Utah. Now, I say nothing. They started a couple trail series and a couple different things just recently, but this is a Thursday night. You go out afterwards, have a date night, get a little healthy stuff in first, head out and enjoy the rest of the evening. Nobody's really concerned if you're not so productive on a Friday. So again, Company Cup 5K and the Wasatch Mile. Go to company5k.com to check it out and register. Also, if you have any questions, you can send those to me, Brian, B-R-I-A-N, at company5k. That's the number 5k.com. Today I want to talk to you about muscle stim and how we would use it for patellofemoral pain syndrome. So this is a part 1 of 2. This will be part 1 today, and tomorrow will be part 2. The reason why we would use the electric stim for patellofemoral pain syndrome would be, for one, if we need to increase the quad strength. Now, a lot of people come into me and they say, oh, my quad should be fantastic. I'm a runner. Unless you're running hills, stadium stairs, whatever, okay, the reality of it is that the quadricep is a decelerator of the knee and the lower leg. It does not do a whole lot to get you propelled forward. The glutes and hamstrings are our primary movers, not the quads. So if somebody has a tracking issue, if they've got where the kneecap glides lateral or medial, if they've got an issue where the patella sits a little bit higher, the kneecap sits high, called patella alta, and it no longer sits in the knuckle. Okay, so normally the patella should sit right up against the femoral condyle. If it sits a little high, it can track sideways, back and forth. Those are issues and times where you'd say, hey, you know what, we probably need to build up the quadricep in order to prevent that from occurring. Now, I've showed you some tape jobs in the past to help with the knee pain, where we can kind of pull the tape into a medial glide. That allows for a better support. It allows the kneecap to track a little bit easier. But a long-term solution, so that you're not having to tape all the time, would be to actually build the quadricep up. Now, there's lots of strengthening exercises that are available, and I'll be happy to share those with you. And I've actually shared some of those with you in some other videos. But the reason why we would use the muscle stim is that we would actually place a couple of electrodes on, run an electrical current through. What this does is that it allows you to build the muscle without actually having to take the joint through the range of motion, which would then cause the patella irritation or pain. So how would we do this? I'll show that to you tomorrow exactly. Why we would do this though still is the electrical current are nerves that innervate those muscles, that actually penetrate into the muscles to give the message to either move or sensation to the skin and to the area. Send an electrical impulse back and forth to the brain. So it works on that same electrical impulse. We send the electricity in, we actually get a muscle contraction. You can do this with Russian stim. You can do it with a biphasic stim. You can do it with an EMS, some portable models. Tomorrow I'm going to show you the portable model that we have, and I'll show you where to get this stuff. But the nice thing about this is that you literally, just you take a couple of the pads, and we've got a stim unit right here. We take a couple of those pads, we apply them to the rectus femoris and to the vastus medialis, so the teardrop muscle on the inside of the knee and the one directly in the middle of the thigh. There's been some research that 10, 15, 20 years ago we would say, oh, it's definitely the VMO. Now it really looks like it's just the entire activation of the quadricep allows the kneecap to track better, so we can't really just pinpoint into one. But a lot of the protocols from what we've seen is that if you get the VMO and the rectus femoris to contract, that it actually glides the kneecap into the lack of a better word, the femoral condyles, okay, the patellar groove in there, and allows then for the knee to stabilize. You don't have to take the knee through the joint range like if you were doing lunges or squats. in order to kind of again cause the irritation. We can build that strength. Strength can take anywhere between 8 to 12 weeks. Typically, you'll notice an improvement after the first 2 to 3. That way we know we're on the right track. We know that it is going to work. That's the big thing. A lot of people are like, how am I going to know if it's going to work? 3 to 4 weeks, you should know. Okay, so that's it, part 1. This is episode 162 of the Mesh Tongue. I will see you again for part 2 tomorrow on muscle stim and patellofemoral pain syndrome. Again, if you got any questions, please send those to me, Brian, B-R-I-A-N, at company5k.com. Also, please don't go hurting yourself to come back. Share this with your friends, your family, your training partners. I'll see you again tomorrow. All right, take care.